Welcome to Physio World. Today I am going to discuss about dermatomes. What is dermatome? It is an area of skin in which sensory nerves derive from a single nerve root, or we can say it is a sensory distribution to the skin by single nerve root. We having 31 pairs of spinal nerves. What are that? 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Each spinal nerve divides into anterior and posterior rami. Why we want to know dermatomes? It is useful to help localize neurological levels, particularly in radiculopathy, and for assessing and diagnosing the level of spinal cord injury in the Asia impairment scale. So we can assess the neurological level and we can assess the level of spinal cord injury by knowing dermatomes or dermatological mapping. Okay. Now dermatome is developing. So it is developing from the outer portion of an embryo. From that it is arise from the somatic mesoderm. So in the developing embryo, dermatome arise from the somatic mesoderm. So this is how the dermatome is developing. Now we can know about the dermatological mapping. So here is the sum of the picture of head, neck and face. Okay, so we are learning about the dermatomes of the head, face and neck. So first we can learn about the trigeminal division, how it is applied to the face. So trigeminal, there is three division. First one is ophthalmic branch, that it is supplied to the top of head, and then maxillary branch, that it is supplied to the nerves to top of lip, and then third is mandibular branch, that it is supplied to bottom lip to jaw. So these three branches is applied to the face. And then we have to tell about the C2, C3. So this C2 is supplied to the occipital protuberance, and then C3 is supraclavicular fossa, you can see, and then C4 almost around the acromioclavicular joint. And here is also some of the nerve, that is C4, C5, C6. So from here, that is posterior aspect of or back of neck. Okay, so this is how the head, face and neck is supplied by the dermatome. So we know why dermatome is a sensory distribution. Now, now we can learn about the dermatomes of trunk. So you can see here so many lines. Okay, so like that only dermatological distribution of trunk is like evenly spaced out. There's a chance for occurring overlapping also. So here in the trunk there is no completely absence of sensation but can occur decrease in sensation. Now we can see how the dermatome is supplying. So at the T3 there is third and fourth intercostal space. So this T3 is runs along the third and fourth intercostal space, and then about the T4 you can see at the nipple line, and then T6 at the level of xiphoid process, and at the T12 just above the hip girdle. So remaining all like T7, T8, T9, T10, T2, T11, T1, all that evenly distributed between the above mentioned thoracic dermatome. Okay. Now we can see now we can see dermatomes of the upper extremity. So here some complex distribution, but okay, when we are describing, first we can describe C5. Simply when we are saying that it is distributing at the lateral antecubital fossa or lateral aspect of the upper extremity at and above the elbow. So at and above the elbow and lateral aspect of the upper extremities, C5 is distributing. Now C6, here you can see lateral aspect of the forearm and the radial side of the hand and the thumb. So C6 is supplying. Now C7. So here is C7, that is on the middle finger, and C8 little finger, or we can say the skin over the small finger and medial aspect of each and hand. T1 medial antecubital fossa. or medial side of the forearm, that is this T1 is supply. Now T2 apex of axilla here. Okay. Here we will go for dermatomes of the lower extremity, and in the picture itself we can see there is a spiral arrangement of the lower extremity. Okay, so first one is L1. So from the skin over the back of L1 vertebra, and it wraps around the lower trunk to the hip girdle. Okay, so here is anterior upper thigh. Second one is L2, that is mid anterior thigh, and L3 here it is on the medial femoral condyle, and then L4 that is to the medial malleolus, and L5 that is to the dorsum of third metatarsal. Here you can see in the picture as a third metatarsal and phalangeal joint, and S1 is on the lateral heel. So L1 to L5 that is on lumbar plexus. Okay, next one is S1 that is lateral heel, and then S2 on the popliteal fossa, S3 ischial tuberosity, S5 is perianal area. So these are the dermatological distribution of the lower extremity. L1 is on the upper anterior thigh, then L2 mid anterior thigh, L3 mid femoral condyle, L4 is on the medial malleolus, L5 is on dorsum of third metatarsal and phalangeal joint, S1 is lateral heel, popliteal fossa, ischial tuberosity, and then perianal area is by S5. Now we can say about the dermatome spatial test. By the two method we can do a test for dermatological distribution. One is pin prick test. Why we have to know whether the sensation is lost or is there. Okay, so first one is pin prick test. So how it is doing? It gently touches the skin with the pin, and then we will ask the patient whether it feels sharp or blunt. Okay, so this is for pin prick test is for pain sensation. Second one is light touch test. So dab a piece of cotton wool on an area of skin, then we will ask the patient to whether it is feeling or not. Then this test is done for a light sensation. So how it is doing? The procedure is patient should close her eyes and gives feedback regards to various stimuli and should be compared bilaterally. Both tests should begin distally then proximally. So this is the method how we have to do the spatial test. Thank you. If you have any doubt or any suggestion, you can write it on my comment box. See you then. Bye.